The skeleton is the framework of the body. Without it, the body would be without form, and it wouldn't even be possible to walk upright. Among its many functions, the skeleton serves to protect vital organs such as the brain, the heart, and the lungs.
Here are some common skeletal injuries. First, we have fractures. Fractures commonly happen because of car accidents, falls, or sports injuries. Next is dislocation. Dislocations are often caused by sudden trauma on the joint, like an impact or fall.
Oh no! Sir, you're right? Sir, are you okay?
A fracture is a broken bone. It requires medical attention. If the broken bone is the result of major trauma or injury, call your local emergency number. Don't move the person except if necessary to avoid further injury. Apply ice packs to limit swelling and help relieve pain. Do not apply ice directly to skin. Wrap the ice in a towel, a piece of cloth, or some other material. To support the fractured arm, use the technique of the triangular bandage.
Sling to stop someone's arm moving, to protect it and prevent further damage. There are two types of sling, an arm sling and an elevation sling, and both can be made using a triangular bandage. The difference between these two types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. You just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder. And the bit that's hanging down, bring that up to beat it. If you just let go of your arm for me now, and then re-support it. Lovely. Just tie a reef knot. And then tuck the corners underneath. And make sure the whole of the arm is supported, down to the little finger. With the bit that's left over, just twist it until it becomes nice and tight and it snugly fits in around the elbow. To make an elevation sling, first ask the casualty to support their injured arm. You just support it there for me, and their fingertips should be touching the shoulder. Lay your triangular bandage over the injured arm. Just get the casualty to hold it in place. Just hold it there for me. Come underneath the arm, around the back, and then tie using a reef knot. And then just tuck the points under. With the bit that's left over, just twist it until it's nice and tight and it fits snugly in by the elbow. To check circulation, you need to squeeze the fingernail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the sling is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes.